He said to me, and I want you to hear these words exactly as they were spoken. He said, "You already know what this is. You've seen the numbers. You came back so you would recognize it when it arrived. I am here tonight because it has arrived. You have felt it. Some of you have been watching the data, watching the news, watching the silence where an alarm should be, and feeling a dread you cannot quite name to anyone around you. I know that feeling. I lived with it for 14 months before I understood what it was. It is not anxiety. It is not paranoia. It is recognition. And what I was shown 11 minutes after my heart stopped explains exactly why that recognition is correct, and why what is coming is something none of us are prepared for in the way we need to be. I am a physician, 24 years in emergency medicine, former infectious disease consultant, CDC affiliated, H1N1 response, the early COVID surge at a major hospital system in Memphis. I am the last person who should be standing here saying any of this. I spent my entire career treating the body as a machine and religion as a psychological phenomenon. I wrote a paper, unpublished mercifully, arguing that near-death experiences were oxygen deprivation artifacts. I was thorough about it. I cited the literature. I was wrong about almost everything. I waited 14 months to say what I am about to say. I want you to understand that. I did not rush to a camera. I consulted 2 neurologists and a psychiatrist, colleagues, people who knew my work, people who had every reason to offer me a clinical explanation I could accept. None of their explanations fit. Not one. And in early 2025, I began seeing correlating signals in real infectious disease data that matched specific details of what I had been shown on the other side. I told my wife, Carol. She listened to everything. Then she said, "Raymond, if you don't say it and it happens, you will never forgive yourself." She was right. I know she was right. And so I am here. I know some of you have felt something like what I felt. That background certainty that something enormous is building, that the official accounts don't add up, that you are watching the setup for something and no one around you will say it plainly. Here is what I found on the other side of it. Here is what I was sent back to tell you. It was November 14th, 2023, a Thursday, 4:17 in the morning. I want you to understand what kind of morning that was before I tell you what happened. Not because it matters in itself, but because the ordinary texture of it is part of the testimony. I had been doing part-time urgent care work since my semi-retirement in 2022. 2 shifts a week at a clinic on Nolensville Pike, South Nashville. I kept those shifts because I needed to stay useful. 24 years of emergency medicine does not let you go quietly. I had a cup of coffee from the machine in the break room. I was reviewing a patient file from the previous evening. Nothing serious. A respiratory complaint I had flagged for follow-up. Maria, my medical assistant, was in the back filing charts. The waiting room was empty. It was the kind of quiet that only exists at 4 in the morning in a medical setting, and I had always found it the most honest time of the day. I felt the pressure first. Substernal. A heaviness I can only describe as deliberate. Not pain yet, just weight. And I knew. I have described that symptom to thousands of patients over the decades, and I knew immediately, clinically, the way you know 2 plus 2, what was happening inside my chest. I had time to say Maria's name, and that was all. What followed is documented. Maria called 911 at 4:18. 3 EMS units arrived at 4:31. I was in full cardiac arrest, 0 electrical activity, for 11 minutes before they got a rhythm back. They transported me to Vanderbilt University Medical Center. I spent 6 days in the cardiac ICU, 2 of them sedated. My cardiologist is Dr. Patricia Sohn. The records exist. The timeline is not in dispute. I tell you this not to establish drama, but because everything I am about to say rests on the documented fact of those 11 minutes. This is not a dream I had. This is not a dissociative episode. This is what happened to a physician's consciousness during 11 minutes of clinical death. And I need you to hold on to the specificity of that while you hear the rest of it. There is a moment, I know exactly when it was because I have since gone back to the EMS report and cross-referenced, where the electrical activity in my heart stopped completely. In that moment, I was not in the clinic anymore. I was not in any physical location I can name. But I was more present than I have ever been in waking life. Not more awake, more present. As if everything I had experienced up to that point had been filtered through gauze, and the gauze was gone. The disorientation was not about being dead. I want to say that carefully. The disorientation was about how wrong I had been about almost everything I believed. What I want to tell you about, the reason I am here, the reason I waited 14 months and then could no longer wait, begins with the first thing I was shown. Not told, not explained. Shown in a way that bypasses the step of explanation entirely. The way a diagnosis arrives when you already know the answer before you have finished running the test. The first thing I understood, with the totality of that understanding I just described, is that what was coming was not coming. It was already here. I need you to stay with me on that sentence because the distinction matters more than almost anything else I will say tonight. Not a future event. Not a prophecy about something approaching on the horizon. A present fact about something already in motion. The word that arrived in me, not heard, arrived, the way a certainty arrives, was that the pathogen was already in the rooms. Plural. Rooms. Not a room. Rooms. Hospital rooms, care facility rooms, the ordinary rooms where people go when something is wrong with their breathing. And it was being seen and it was being categorized as something else, because it behaved enough like other things that no one had stopped yet to ask why the numbers were quietly wrong. I am a physician. I know what misclassification looks like. I know what it produces downstream. I have seen what happens when a novel pathogen's early presentations are absorbed into existing diagnostic categories because the alternative, naming something new, requires more certainty than the system wants to act on yet. I spent weeks during the early COVID surge watching that exact process in real time. So when I say the word misclassification landed in me on the other side of my own death, I am not using it metaphorically. I am telling you that a specific clinical phenomenon was communicated to me in the vocabulary of my own profession, because whatever was communicating with me understood exactly what language I would need. What I was shown was a pathogen with a transmission profile I recognized as respiratory, and a pre-symptomatic window significantly longer than COVID's. If you lived through 2020 and 2021, you know what pre-symptomatic spread does to a population. You watched it in real time. You watched the arguments about whether people without symptoms could transmit. You watched the weeks lost while that argument happened. Now extend that window, make it longer. Give it to a pathogen that is already in the rooms and is currently being called something it is not. And you begin to understand what I was shown, and why what I was told afterward used the number 10. I want to say something about that number before I continue, because I have thought about it every day since returning. When I say this will be 10 times worse than COVID, I need you to understand I am not a person who uses numbers rhetorically. I do not say 10 times worse the way someone says I've told you 1,000,000 times. I am telling you that 10 times worse is what was communicated to me, specifically, and that when I came back I spent months trying to understand what metric it applied to. Mortality? Infection rate? Duration? I do not know. What I know is that it was not given to me as an approximation, or a way of conveying severity abstractly. It was given as a number, and I believe it means something specific that I am not fully equipped to translate. If you have had a respiratory illness since late 2024 that did not quite behave like flu and did not quite behave like COVID, or if you know someone who has, I want you to file that in a specific folder in your mind while you hear the rest of this. I am not asking you to panic. I am asking you to pay attention the way someone told me to pay attention. Someone who exists on the other side of what we are walking toward. But that was only the first thing I was shown. And what came second made the first look like a warning label on the side of a bottle. The second thing, and this is where the conversation became personal in a way I was not prepared for, was about what 10 times worse actually means in terms of the world you and I are living in right now. I was not shown a death toll. I want to be precise about that. I was not shown a number of bodies or a graph of mortality or anything that would function as a statistic. What I was shown was a systemic event. And the difference between those two things is the most important thing I can communicate to you in the time we have together. COVID killed people. Hundreds of thousands of people in this country. The grief of that is real, and I do not minimize it. But the systems held. Broken, strained, inadequate in ways that are still being written about, but they held. Hospitals stayed open. Staff kept reporting. Supply chains bent but did not break. The infrastructure that treats the dying remained, broadly, operational. What I was shown does not leave the infrastructure operational. I was shown empty hallways, not abandoned, that is not the right word, suspended. I was shown a pediatric ward. I know it was pediatric because of the scale of the equipment, the beds, the fixtures. In the middle of a day I somehow understood was not a night or a weekend or a holiday. Full daylight, fully functioning equipment, no patients, no staff. Not because everyone was sick, because the social fabric around reporting to work had broken in a way that none of the contingency plans had ever fully modeled. I have to tell you that image has stayed with me more than anything else from those 11 minutes. More than the words that were spoken to me. More than the certainty about the pathogen. A dark pediatric ward in the middle of a working day. I am not someone who cries easily. Carol will tell you that. My daughter, who is a nurse practitioner in Atlanta, will tell you the same thing. I cried when I described that ward to Carol. I cried again writing down what I remembered of it in my journal. I do not fully understand why that image carries more weight than the others. I only know that it does. What it means in practical terms is this. The 10 times worse is not primarily about the virus. It is about what happens to treatment capacity when the people responsible for delivering that treatment reach a threshold. A specific human threshold that every healthcare worker in this country already feels in their body, and step back. Not from callousness, from survival. From the ordinary human limit that says I cannot give more than I have. COVID pushed that limit. What I was shown pushes past it. And when the capacity to treat collapses, the mortality follows. That is the sequence, not the other way around. I am telling you this because if you have someone in your life in healthcare, in emergency services, in any part of the infrastructure that holds together when everything else is breaking, you need to understand what they are being asked to carry. Not abstractly, concretely. Right now, today, before any of what I was shown has fully arrived. Because I believe that the people who will matter most in what is coming are already in your life, and most of them are already running on fumes, and almost none of them have been told what I was told about what is on the way. And then he spoke. I want to address this directly because I know what some of you are thinking, and I respect that. I am a physician. I spent 30 years treating religion as a psychological phenomenon, as a coping mechanism, as something that belonged to the patients and not to me. I am not asking you to adopt a theology. I am not asking you to accept a label for what I encountered. I am telling you that what spoke to me identified itself, and that identification was not ambiguous, and that I, the man who wrote a paper arguing that NDEs were oxygen deprivation artifacts, did not have the internal resources to dismiss what I heard. What was said to me was said in 3 separate statements. I have memorized them the way you memorize something you know you are going to be responsible for. I have written them down. I have returned to them so many times that they are more present to me now than most of what I knew before November 14th. The first was this: the warning was sent before. It was not heard. I understood this immediately as a reference to COVID, not as a theological statement, as a factual accounting. COVID was a warning, not in the sense that it was manufactured or purposeful in the way conspiracy theories suggest. I am not saying that, and I do not believe that. But in the sense that a warning is information delivered before the full event, giving the recipient time to respond. And the response, as a civilization, as a healthcare system, as a country, the response was inadequate in ways that were not primarily about logistics. The inadequacy was deeper than logistics. That is what I understood by "it was not heard." The second statement was this: those who are prepared will be asked to care for those who are not. I have spent more time with this sentence than with anything else I was given, because it is not a comfort statement. It sounds like one at first, but if you sit with it the way I have sat with it, you realize it is something else entirely. It is a mission statement. It is a description of a role that is being assigned right now, to the people who hear what I am telling you, to the people who take what I am saying seriously enough to do something with it before the time to act closes. The people who are prepared will be asked to care for those who are not. That is not a promise that prepared people will be safe. It is a description of what they will be required to do. I want you to be honest with yourself about the difference. The third statement is the one that made me decide to speak. The time between now and then is the gift. Use it as such. I want to stop here. I want you to actually receive that sentence before I say anything else around it. Not because it is poetic, because it is precise. The time between now and then, meaning between the moment you are sitting in right now and the moment what I was shown arrives in full. That interval has been characterized to me by whatever I was in the presence of as a gift. Not a warning period, not a countdown. A gift. And the specific instruction attached to it was to use it as such. I knew when I came back that I had wasted the 14 months I spent trying to rationalize away what I had experienced. I knew it even while I was doing it. Every month I spent consulting colleagues and running database searches and writing journal entries that I never shared was a month of the gift spent in silence. I am not spending another one. I want to say something now that I do not say easily. Returning from what I experienced is not what people imagine when they imagine it. The accounts you have read, the peace, the light, the feeling of coming home, I am not going to tell you those are wrong. What I am going to tell you is that returning from that is a specific kind of grief that nothing in medical training, in human experience, in any conversation I have had in the 14 months since, has fully prepared me for. What I left was correct. That is the only word I have for it. Everything there was correct. The proportion of things, the weight of things, the way things related to each other, all of it was correct in a way that nothing here is. And coming back to a world where almost nothing is correct is something you carry in your body in a way that does not resolve. Carol says I seem far away sometimes. She is right. Part of me is still in that room on Nolansville Pike at 4:17 in the morning, and another part of me is somewhere I cannot get back to. And the part of me that is standing here talking to you is doing its best with what it was given. I was shown my daughter before I came back. She works in a hospital in Atlanta. She was not a patient in what I saw. She was one of the people still standing when most were not, in a hallway that needed her there. And I understood, completely, without ambiguity, That part of why I was being sent back was for her, for people like her, for anyone who would be in that hallway when the lights were out and the ward was suspended and the system had reached its limit. What I was carrying back was for them. That is not a metaphor. That is what I was shown as the reason. I want you to stop for a moment, before the closing, before I tell you what I am asking of you. I need you to actually sit in what I have said. There is a pathogen already in the rooms. It is being misclassified. It has a pre-symptomatic window longer than COVID's and a capacity to overwhelm healthcare infrastructure in a way COVID did not fully accomplish. The warning was sent before, and it was not heard. Those who are prepared will be asked to care for those who are not. And the time between now and then, the time you are sitting inside right now, in whatever week this reaches you, on whatever morning or evening you are watching this, is the gift. That is what I came back carrying. The phrase I have returned to every single day since November 14th is this: the time between now and then is the gift. Use it as such. I am giving it to you now as the thing to hold on to, not as comfort, as instruction. Because comfort is not what I was sent back with. What I was sent back with is specific and practical and meant to reach the people who are willing to hear it. This week I want you to do one concrete thing, just one. Think about the person in your life who would be most essential in a public health crisis. A nurse, a physician, a paramedic, a pharmacist, a person who works in the supply chain of medicine. And I want you to reach out to them, not to warn them, not to frighten them, not to tell them what you heard from a physician who died for 11 minutes in Nashville. Just to tell them you love them, and that what they do matters, and that you see the weight they are already carrying. Because the people who will be asked to care for those who are not prepared are already in your life, and most of them have not heard that in a long time. That is something you can do this week. That is something the gift of time allows for. Beyond that, and I say this as a physician, not as a prophet, not as someone who is asking you to do anything rash. Pay attention to the respiratory anomalies that do not quite fit the standard categories. If you are in a position to talk to a doctor, ask them what they are seeing that they do not have a clean name for yet. The pattern I was given to watch for is already partially visible in the data, and the people who are watching carefully will be the people who have time to prepare. I believe you are watching this because you were supposed to watch this. I do not say that the way it sounds in a motivational speech. I say it because it was included in what I was told. This message was given to me to bring back. The people it would reach were described to me as people who would already feel its truth, who would recognize it not as something new but as confirmation of something they already sensed. If you felt something hearing this, if even one part of it landed in the place where you keep the things you know but cannot say out loud, then you are one of the people this was for. I am not asking you to trust me. I am asking you to test what I have said against what you already know, against what you have felt, against what the data you can find yourself already shows. I am a physician. I deal in verification. I am asking you to apply that same standard to what I have shared. If what I shared today reached you, subscribe to this channel. Not for me, because there are more accounts like mine. More people who came back carrying something the world is not ready to hear. And the fact that you are here tells me you are someone who is willing to listen. The notification is a reminder that the record is still being kept, and that what was brought back from the other side is still being said, and that someone is still here to say it. In the comments before you leave, I want to ask you something. What do you want the people who come after you to know about what you believe is happening right now? Not what you think you are supposed to say. Not the public answer. The private one. What do you actually believe is building? And what do you want the record to show that you saw it and said so? Leave it. Make it part of the record here. The phrase is this. Write it down if you need to. Come back to it when the news makes everything feel impossible. when the weight of what is happening in the world makes the ordinary seem unbearable, when you want to believe you were imagining it. The time between now and then is the gift. Use it as such. I came back for a reason. I believe this conversation is part of it. Whatever is coming, and something is coming, and it is already closer than most people are being told. I hope this reaches you in time.